gently release it. Today we're going to explore two different approaches to exfoliation, physical and chemical. Both can be effective, but they work in very different ways. Understanding these differences will help you choose the method that's right for your skin, your lifestyle, and your goals. There's no single correct answer, only what works best for you. Let's begin by understanding what exfoliation is at its core. Exfoliation is the process of removing dead skin cells from the surface of your skin. Your skin naturally sheds these cells continuously, but sometimes they accumulate, leading to dullness, rough texture, and clogged pores. Exfoliation helps accelerate this shedding process, revealing fresher, brighter skin underneath. The key difference between physical and chemical exfoliation is how they accomplish this goal. Physical exfoliation uses manual friction, scrubbing, rubbing, or abrading to physically remove dead cells. Think of it like using sandpaper to smooth wood. You're mechanically buffing away the rough outer layer. Chemical exfoliation uses acids or enzymes to dissolve the bonds holding dead cells to your skin. Think of it like using a solvent that loosens glue. The cells can then shed naturally without scrubbing. Let's explore physical exfoliation first. Physical exfoliants come in many forms: scrubs with granular particles, sugar, salt, jojoba beads, coffee grounds, cleansing brushes, konjac sponges, washcloths, exfoliating gloves, and microdermabrasion tools. The main advantage of physical exfoliation is immediate gratification. You can feel it working right away. Your skin feels noticeably smoother instantly. There's something satisfying about that immediate textural change. Physical exfoliation is also straightforward to use. You don't need to understand pH levels or wait times. You simply scrub and rinse. The simplicity appeals to many people. Some physical exfoliants provide gentle, effective exfoliation. Konjac sponges, for example, are incredibly gentle and perfect for sensitive skin. Fine, round jojoba beads provide smooth exfoliation without harsh abrasion. These gentler options can be excellent choices. However, physical exfoliation has significant drawbacks that you need to understand. First, it's easy to over-exfoliate with physical methods. That clean, smooth feeling can be addictive, leading people to scrub too hard or too frequently. Over-scrubbing damages your skin barrier, causes micro-tears, and leads to irritation, redness, and sensitivity. Second, many physical exfoliants are too harsh. Scrubs with irregular, sharp particles, like walnut shells, apricot kernels, or salt crystals, can create micro-tears in your skin. These tiny injuries compromise your barrier, allow bacteria to enter, and can lead to inflammation and infection. Third, physical exfoliation is uneven. You apply more pressure to some areas than others. You might over-scrub your cheeks while under-scrubbing your forehead. This inconsistency can lead to uneven results. Fourth, physical exfoliation isn't ideal for sensitive, acne-prone, or rosacea-prone skin. The friction and pressure can aggravate these conditions, causing more inflammation and problems. Fifth, physical exfoliation only works on the surface. It cannot penetrate pores, so if your main concern is clogged pores or blackheads, physical exfoliation won't be very effective. Now let's explore chemical exfoliation. Chemical exfoliants include AHAs, alpha hydroxy acids like glycolic and lactic acid, BHAs, beta hydroxy acids like salicylic acid, and enzymes like papain from papaya and bromelain from pineapple. The main advantage of chemical exfoliation is controlled, even results. When you apply a chemical exfoliant, it works uniformly across your entire face. Every area gets the same level of treatment. This consistency produces more, even predictable results. Chemical exfoliation is gentler on your skin barrier. There's no physical friction or scrubbing, so you're not creating micro tears or damaging your skin through mechanical force. The acids simply dissolve the bonds between cells, allowing them to shed naturally. Chemical exfoliants can penetrate pores. BHAs, especially being oil-soluble, can work inside your pores to clear clogs from within. This makes them far superior to physical exfoliation for treating blackheads, whiteheads, and acne. Chemical exfoliation offers additional benefits beyond just removing dead cells. AHAs increase hydration, stimulate collagen production, and fade hyperpigmentation. BHAs have anti-inflammatory properties. These bonus benefits add therapeutic value. Chemical exfoliation is customizable. You can choose different acids, concentrations, and frequencies to match your specific needs and tolerance level. You have much more control over the intensity and effects. However, chemical exfoliation also has challenges. First, there's a learning curve. You need to understand different acid types, proper concentrations, pH requirements, and how to safely incorporate them into your routine. This takes research and patience. Second, chemical exfoliants require sun protection. AHAs increase sun sensitivity by removing that protective layer of dead cells. You must be diligent about sunscreen when using chemical exfoliants. Third, initial purging can occur, especially with BHAs. Existing clogs may surface more quickly, causing temporary breakouts before your skin clears. This can be discouraging if you don't understand it's a normal part of the process. Fourth, chemical exfoliants take longer to show results. While physical exfoliation provides instant smoothness, chemical exfoliation's deeper, more significant improvements take weeks of consistent use to become visible. Fifth, chemical exfoliants can cause irritation if used incorrectly. Starting with too high a concentration, using them too frequently, or combining them with other strong actives can damage your skin barrier. So how do you choose between physical and chemical exfoliation? Consider your skin type first. If you have sensitive, reactive, or acne-prone skin, chemical exfoliation is generally better. The gentle, controlled nature works better for delicate skin. If you have resilient, normal skin, either method can work, though chemical is still typically gentler. Consider your skin concerns. For dullness and rough texture, either method works. For hyperpigmentation and fine lines, chemical exfoliation, specifically AHAs, is more effective. For clogged pores and acne, chemical exfoliation, specifically BHAs, is far superior. Consider your lifestyle. If you're bad about sunscreen, chemical exfoliation isn't ideal for you. It increases sun sensitivity too much. If you want something simple that works immediately, gentle physical exfoliation might suit you better. If you're willing to invest time in learning and being consistent, Chemical exfoliation often produces better long-term results. Consider your preferences. Some people love the ritual and tactile satisfaction of scrubbing. Others prefer the hands-off simplicity of applying a toner or serum. Honor your preferences. The best routine is one you'll actually follow. Can you use both methods? Yes, but carefully. Some people use gentle physical exfoliation once a week and chemical exfoliation 2 to 3 times a week. However, this increases the risk of over-exfoliation. If you combine both, start conservatively and monitor your skin closely. If you choose physical exfoliation, follow these guidelines. Choose gentle exfoliants with smooth, round particles. Avoid harsh scrubs with irregular, sharp particles. Konjac sponges, jojoba beads, and fine rice powder are good options. Use light pressure. You should never scrub vigorously. Gentle circular motions with barely any pressure are sufficient. Limit frequency. Once or twice a week is plenty for most people. Daily physical exfoliation is almost always too much. Avoid scrubbing active acne, inflamed areas, or open skin. Never scrub if your skin is sunburned, windburned, or otherwise compromised. Follow with hydrating, soothing products to support your barrier after exfoliation. If you choose chemical exfoliation, follow these guidelines. Start with low concentrations and build up slowly. Patience is crucial. Use acids on clean, dry skin for best results. Always follow acids with moisturizer to support your barrier. Use sunscreen diligently every morning. Monitor your skin for signs of overexfoliation, redness, burning, excessive sensitivity, or shiny, tight skin. Don't combine multiple strong actives without understanding how they interact. The ultimate truth? For most people, properly used chemical exfoliation produces better, longer-lasting results with less risk of damage than physical exfoliation. However, very gentle physical exfoliation used occasionally, carefully, can be a pleasant addition to a routine. The worst approach is aggressive physical exfoliation, harsh scrubs used frequently with vigorous pressure. This damages skin far more than it helps. As we close, remember that exfoliation is just one tool in your skincare toolkit. It's not mandatory. If your skin is healthy, comfortable, and you're happy with it, you don't need to exfoliate at all. Your skin will shed cells naturally, but if you want brighter, smoother skin, proper exfoliation can help. Choose the method that fits your skin, your concerns, and your lifestyle. Use it wisely, gently, and consistently. Take a deep breath in and release it slowly. Trust yourself to make the right choice for your unique skin. May you find the exfoliation method that serves you best. May you use it with wisdom and gentleness.
Most retinization symptoms peak at weeks 2 to 4 and resolve by weeks 6 to 8. However, expecting this phase mentally prepares you to persist through it rather than discontinuing retinoids prematurely. Managing retinization involves strategic moisturizing. The sandwich method, applying retinoid, waiting 20 minutes, applying moisturizer, waiting a few minutes, then applying another thin moisturizer layer, significantly reduces retinization severity while maintaining efficacy. As your skin adapts over 8 to 12 weeks, you can gradually stop using the sandwich method, eventually applying retinoid directly to dry skin. Buffering retinoid strength temporarily by mixing it with moisturizer reduces irritation without substantially compromising effectiveness. Some experienced retinoid users eventually apply retinoids directly to skin for maximum strength, while others continue using the sandwich method indefinitely because it works well for them. There's no wrong approach. Use whatever maintains your skin health while providing desired results. Niacinamide effectively reduces retinoid irritation. Using niacinamide serum in the morning and retinoid at night doesn't provide the irritation-reducing effect. However, some evidence suggests applying niacinamide before retinoid, allowing niacinamide to dry, then applying retinoid on top, might reduce irritation slightly. This is controversial, with some experts suggesting niacinamide interferes with retinoid efficacy, while others dispute this. For most people, using niacinamide and retinoid at different times is the safest approach. Ceramide-rich moisturizers particularly well support retinoid use by maintaining barrier health during treatment. Using moisturizers specifically formulated with ceramides, cholesterol, and fatty acids alongside retinoids helps prevent excessive dryness and irritation. Combining retinoids with other actives requires careful sequencing. Retinoids should not be combined with AHAs, BHAs, or vitamin C initially. After 12+ weeks of stable retinoid use, you might carefully introduce another active on different nights. Many experienced users successfully use retinoid nightly and salicylic acid or benzoyl peroxide on alternate mornings, but this requires well-adapted skin. Retinoid stability matters for effectiveness. Retinol degrades with light and air exposure. Products in opaque, airtight packaging remain stable longer than those in clear or non-airtight packaging. Storing retinoid products in cool, dark places preserves stability. Retinoids become less effective as they degrade, so proper storage extends product effectiveness and lifespan. Retinoid pulse dosing, using retinoids intensively for periods, then taking breaks, is a strategy some dermatologists recommend. The theory is that continuous daily use might cause adaptation, reduced effectiveness, while pulsing maintains efficacy. However, most retinoid experts recommend continuous daily use for consistent results. Occasional breaks for barrier repair are reasonable, but pulsing isn't necessary for maintaining retinoid effectiveness long-term. Combination retinoid protocols use multiple retinoids simultaneously for enhanced benefit. For example, using low-concentration tretinoin at night combined with retinol in the morning. However, this advanced approach requires very well-adapted skin and should only be attempted under professional guidance. It increases irritation risk and isn't necessary for most people. Pregnancy and retinoid use requires special consideration. Retinoids are teratogenic and should not be used during pregnancy. Women of childbearing potential using isotretinoin must use reliable contraception. Tretinoin used during pregnancy is controversial. Some studies suggest it's safe at prescribed topical doses where systemic absorption is minimal, while others recommend avoiding it. Discuss retinoid use with your obstetrician if planning pregnancy or pregnant. Adapting retinoid use seasonally may be beneficial. In winter, when skin is naturally drier, you might reduce retinoid frequency or concentration, or increase moisturizing support. In summer, if your skin tolerates it, you might increase retinoid frequency for more aggressive treatment. Signs of excessive retinoid use include severe dryness, persistent redness beyond the initial retinization phase, barrier compromise, or contact dermatitis. If you experience these, reduce frequency or concentration. There's no badge of honor for using the highest concentration or frequency if your skin is suffering. Optimal retinoid use maintains healthy skin while providing acne and anti-aging benefits. Guide 34. Sleep quality and acne, mechanisms, optimization strategies, and sleep-specific skincare. Sleep profoundly affects acne through multiple physiological mechanisms. Understanding sleep acne connections and implementing sleep optimization and sleep-specific skincare significantly improves acne. During sleep, your body undergoes restorative processes crucial for skin health. Growth hormone peaks during deep sleep, supporting skin repair and collagen production. Cortisol, the stress hormone, declines during sleep, reducing inflammation. Immune function is enhanced during sleep, supporting the body's ability to fight infection-causing bacteria. Cellular turnover occurs during sleep, with dead skin cells being replaced by new ones. All these processes directly support clear, healthy skin. Poor sleep disrupts these beneficial processes. Insufficient sleep, less than 7 hours nightly, increases cortisol, promotes inflammation, impairs immune function, and disrupts cellular turnover. The result is worsened acne within days of poor sleep. Many people notice acne worsening after only 1 or 2 nights of insufficient sleep, demonstrating sleep's direct acne effects. Sleep timing matters as much as sleep duration. Your body has a circadian rhythm, an internal clock regulating hormone release and physiological processes. Disrupted circadian rhythm, from shift work, irregular sleep schedules, or jet lag, worsens acne even if total sleep duration is adequate. Maintaining consistent sleep schedules, going to bed and waking up at the same times daily, optimizes circadian rhythm function and supports skin health. Sleep quality matters beyond duration. Fragmented sleep with frequent awakenings, even if total sleep time is adequate, compromises skin health. Poor sleep quality is associated with worse acne. Improving sleep quality requires addressing sleep disruptions through sleep hygiene optimization. Sleep position might influence acne through mechanical and bacterial mechanisms. Sleeping on your back avoids facial contact with pillows and your hands, reducing friction acne and bacterial transfer to your face. Sleeping on your side or stomach involves prolonged face pillow contact, increasing friction and bacterial exposure. However, changing sleep position is difficult if you're not accustomed to it. If you naturally sleep on your side or stomach, prioritize other acne management strategies rather than forcing an uncomfortable sleep position change. Pillowcase cleanliness significantly impacts acne. Dirty pillowcases accumulate bacteria, oil, and dead skin cells, all of which transfer to your face during sleep. Some dermatologists recommend changing pillowcases every 2 to 3 days for acne-prone individuals. Alternatively, sleeping on a clean towel over your pillowcase and changing the towel daily is effective and economical. Some people with severe acne benefit from silk or satin pillowcases, which create less friction and accumulate less bacteria than cotton. Bedroom temperature affects sleep quality. Warmer rooms increase perspiration, creating a moist environment promoting bacterial growth and acne. A cooler bedroom, around 65 to 68 degrees Fahrenheit or 18 to 20 degrees Celsius, supports better sleep and reduces nighttime sweating. If your bedroom is too warm, using a fan or air conditioning improves both sleep quality and acne through multiple mechanisms. Humidity in the bedroom affects skin and sleep. Excessively dry air, from heating systems or dry climate, irritates skin and disrupts sleep. Excessively humid air promotes bacterial growth and acne. Moderate humidity, 30 to 50%, is optimal. Using a humidifier in dry climates or a dehumidifier in humid climates optimizes sleep environment and supports skin health. Light exposure, particularly blue light from screens, suppresses melatonin production, disrupting sleep timing and quality. Using devices before bed worsens sleep through this mechanism. Stopping screen use 30 to 60 minutes before bed improves sleep quality. Using blue light filters on devices if evening screen use is unavoidable provides some protection. Oral antibiotics like doxycycline, risks to fetus and teeth, spironolactone, potential effects on male fetus development. Benzoyl peroxide is traditionally avoided though new evidence suggests safety. Potentially safe during pregnancy. Topical salicylic acid used in small amounts and limited areas. Large-scale systemic absorption possible though typically minimal. Topical azelaic acid, generally considered safe. Topical clindamycin, some. Routine predictability helps sensory-sensitive individuals. Consistent routines in consistent order reduce sensory overwhelm compared to variable routines. Minimal product routines, fewer products means fewer sensory inputs, might be better tolerated than complex multi-step routines. A simple cleanse, treat, moisturize routine might work better than elaborate routines. Fragrance sensitivity affects many products. Fragrance-free or lightly scented products work better for fragrance-sensitive individuals. Sensory-friendly product recommendations: lightweight serums, fragrance-free formulations, smooth-absorbing products, minimal texture variations, consistent temperatures, and routines. Professional guidance from dermatologists familiar with sensory sensitivities helps develop manageable treatment plans. Guide 90, Acne and Chronic Illness, Managing Acne while Managing Other Conditions. People managing chronic illnesses, diabetes, autoimmune diseases, chronic fatigue, etc., face additional challenges managing acne alongside other health concerns. Chronic illness causes stress, sleep disruption, and immune dysfunction, all acne worsening factors. Flares of underlying chronic conditions often coincide with acne worsening. Medications for chronic illnesses sometimes interact with acne treatments, requiring careful coordination. Energy limitations from chronic illness might make complex skincare routines unsustainable. Simplified routines are sometimes necessary. During chronic illness flares, simplifying skincare to basic cleanse protect routines is appropriate. During periods of better health, more comprehensive acne treatment is possible. Mental health in chronic illness overlaps with acne's psychological burden. Both require professional support. Healthcare provider coordination between specialists treating chronic illness and dermatology ensures appropriate care. Prioritizing which health concerns to focus on during periods of limited energy helps. Sometimes managing underlying chronic illness takes priority over aggressive acne treatment. Guide 91, Acne Treatment and Vaccination, Timing and Considerations. Concerns sometimes arise about acne medication interactions with vaccines or vaccine effects on acne. Most acne treatments don't interact meaningfully with vaccines. Topical treatments have minimal systemic absorption and don't affect vaccines. Oral antibiotics for acne don't affect vaccine efficacy. Vaccines should be given as scheduled regardless of antibiotic use. Isotretinoin doesn't interact with vaccines, though the immune system suppression during severe acne might theoretically reduce vaccine efficacy. Live vaccines are contraindicated during isotretinoin use due to theoretical immunosuppression risks, though actual risks are minimal. Some vaccines might cause temporary acne flares through immune system activation. This is temporary and doesn't indicate vaccine problems. Vaccines don't cause persistent acne. Any acne appearing after vaccination is likely coincidental timing rather than vaccine-related. COVID-19 vaccines have not been shown to affect acne or interact with acne treatments. Timing vaccines around acne treatment is generally unnecessary. Vaccinations and acne treatment can proceed on standard schedules without coordination. Guide 92. Acne prevention in high-risk children and adolescents. Children with strong family history of severe acne are at high risk for developing severe acne. Early prevention strategies might prevent progression to severe acne requiring aggressive treatment. Starting gentle skin care routines early, non-comedogenic cleansing, sun protection, gentle moisturizing, establishes good habits before acne develops. Education about acne prevention helps young people understand triggers and prevention even before acne appears. Stress management skills learned early help reduce stress-related acne worsening later. Healthy diet and sleep habits established in childhood support skin health throughout life. Early intervention at first signs of acne prevents progression. Some dermatologists recommend seeing high-risk children early for preventive guidance. Avoiding triggers identified through family acne patterns, particular foods, products, environmental factors, might prevent acne development. Psychological preparation for potential acne, normalizing that acne is common, reducing stigma, helps adolescents manage it psychologically if acne develops. Guide 93. Acne in performing arts and image-dependent professions. Performers and those in image-dependent professions, models, actors, social media influencers, experience unique acne-related pressures warranting specialized management. Career-threatening pressure intensifies acne's psychological impact. A small breakout affecting someone's livelihood differs from same breakout's impact on others. Professional makeup demands acne coverage requiring heavy makeup potentially triggering acne cosmetica. Using non-comedogenic makeup and proper removal helps minimize this. Professional headshots and promotional photos emphasize clear skin. Acne interferes with professional image management. Scheduling professional appearances around acne cycles when possible helps. If acne is cyclical, scheduling performances during clear phases. Professional dermatology involvement is often valuable for ensuring consistently clear skin during critical professional periods. Some performers use preventive acne treatment intensification before important performances, temporarily increasing treatment frequency. Mental health support helps manage the intensified appearance pressure these professions create. Guide 94. Acne and sleep disorders, managing acne while managing sleep issues. Sleep disorders, insomnia, sleep apnea, restless leg syndrome, create multiple acne worsening factors making acne management more challenging. Sleep deprivation from any sleep disorder worsens acne through stress hormone, immune, and inflammatory mechanisms. Sleep medications sometimes worsen acne. Discussing with sleep specialists whether acne worsening might relate to sleep medications is appropriate. Treating underlying sleep disorders often improves acne significantly through improved sleep quality and stress reduction. Managing both sleep and acne requires comprehensive approach addressing both conditions. CPAP machines and other sleep disorder treatments might trigger acne through skin irritation. Using protective barriers and keeping equipment clean helps. Guide 95, Acne and Fertility, Female and Male Considerations. Acne treatments have fertility implications requiring consideration for those planning pregnancy or concerned about fertility. Isotretinoin is highly teratogenic and absolutely contraindicated in pregnancy. Women of childbearing age must use reliable contraception while on isotretinoin. Spironolactone might affect male fetus development. Stopping spironolactone while planning pregnancy or if pregnancy occurs is generally recommended. Birth control pills used for hormonal acne obviously affect fertility planning. Stopping pills when planning pregnancy allows pregnancy attempt. Other acne treatments don't significantly affect fertility and can be continued during fertility attempts.